Good morning, dear students. I thank the organizers for this proud privilege to address you, the bright next generation, on the occasion of Women's Day. The journey of woman began from a long route. It began her role which confines to home, and then taken a long route, persistent efforts and fights for fundamental rights to get the dignified place in the society. I have seen recently few young and fierce women who take the challenges in their profession. Here, on this occasion, I would like to quote few examples of a journalist. Her name is Shweta Singh, who is working for Aaj Tak TV channel. Presently, she is in the war field, working there and giving news, minute to minute news to us, just like very casually, just like how I am speaking to you. She is a wonderful woman. The location is surrounded by the fire, but she is not having any fear. Such a wonderful woman. Hats off to her work. By this we can understand that a woman, what she cannot do it in this today's world. She can hold the breath and give life into it. Any role she plays, it emerges victoriously. There are so many scientists, women scientists. Recently we have come across Gaganayana, Mangalyana. Such scientists are also working. Women scientists are also working. But we should remember that there are very few women in this field. Very handful. Therefore, in coming years, and we expect the woman from all walks of life to play a major role, dominating role in the mainstream of the society. One important message I would like to give on this occasion, that the responsibility of uplifting underprivileged women rests on our shoulders, and it is our duty to do it. May this Women's Day ignite that spark on you. If you have the privilege to be educated or empowered, it is your duty to pass that light to another woman and do best what you can. I want to touch another aspect here, since I am addressing the group of, especially a group of students who are working in the field of Ayurveda. I would like to emphasize the importance and the potentials of Ayurveda in the which you have taken as a profession. Ever since I have entered in the field of Ayurveda, I have witnessed continuously there were discussions going on regarding the allopathic system and Ayurvedic system. Allopathic is superiority of the allopathic medicine, and disheartened expression about the Ayurvedic medicine, Shuddha Ayurveda, Ashuddha Ayurveda. So many such discussions I have come across. But let me know the facts about it. Dear students, don't believe all such things. You think yourself, because Ayurveda is a science of the ancient science. Since 5,000 years we are practicing Ayurveda, and the methods and practices have stood the test of time. I would like to quote few examples regarding this, and you will understand the depth of it. Many principles of Ayurveda and the practices mentioned in Ayurvedic text are followed by modern doctors. I quote the examples of that. The nebulization, you must be knowing. It is an inhalation therapy. You all know very well. Inhalation therapy. About 35 years back, this therapy was not there in the modern science. Now it is used in the bronchial asthma, to immediate relief of the symptoms. So, and similarly, this nebulization is also used for the purpose of administration of calcium in old women through nebulization for fast absorption of the drug. Students, you must be knowing that this nebulization system was not prevailing. Now this is adopted from Ayurvedic science. What the Dhumapana we call, it is nothing but nebulization. And a doctor of modern medicine who have written a book as bronchial asthma by D. Behra, he quotes that this therapy was prevailing in Ayurvedic system. One more example I quote here about the Nasika. Dasya means administration of the drug through nasal route. Since long we have been practicing it, but now it is adopted by modern doctors. There are many sprays, nasal drops. Even the COVID vaccine, they are preparing through the nasal administration. You must have heard about it. And one more drug I would quote here as the Gugulu. Gugulu is our Ayurvedic drug. Now we find it in the modern pharmacopoeia. They call it as a gugulipid. Since it works on hyperlipidemia, they call it as gugulipid. So you can go and refer. It is there in the modern pharmacopoeia. Again, Kakamachi is the drug in Ayurveda. The extract of Kakamachi. Now it is the study is conducted, research is done. The research will prove as the major breakthrough in the treatment of liver cancer. Similarly, turmeric you must be knowing. That is, the major active principle is curcumin. It is non-toxic drug. It is a promising drug in the cancer of colon and the cancer of the breast. It is also having the properties of anti-inflammatory and antioxidant. Sushruta was practicing the surgery about 5,000 years back. He has left so many techniques of surgery and the plastic surgery even. So these principles and practices are done, adopted by modern surgeons. And if you open the modern surgery, the first line will be Sushruta was the father of surgery, we find. Like this, so many things we quote. There are countless examples. But do you not feel that this work and research should have been done by an Ayurvedic doctors? What I feel is, you must have understood where the field is there. You have many areas you can develop. You can update the Ayurveda. You can do many things in this. So there is no question of disheartenment. You can develop Ayurvedic principles and Ayurvedic practices. You can do it very well. But however, I want to express you that this science is about 5,000 years old. In those days, the modern diagnostic technology had not come into existence. We were diagnosing the diseases only on the basis of clinical presentations. Sometimes that alone is not sufficient. For early diagnosis, we need to go through the modern technology to get the picture of the disease, what is going inside the disease, through X-ray, through MRI. All such technologies should be adopted by Ayurvedic doctors, and further you treat according to Ayurveda. This is my message to you. You can understand the strength of Ayurveda at this level, I think. With this message, I hope I have highlighted the role I expect you to play as future generation. I wish you all a bright future. I wish you work to create a work culture of equality and progress. Finally, I thank Shri and Srimati Dr. Prasanna Rao for giving me this opportunity to share my thoughts before you. Thank you all.